Yeah, I think that's what I was like. I feel like it's had my numbers. Maybe I'm gonna when I get back. Yes. And then I would love to come by and talk to you and get really in depth.
That clock is slow. Good morning. My name is Susan Stearns, and I'm the Executive Director of NAMI New Hampshire. NAMI New Hampshire is a grassroots organization working to improve the lives of all people impacted by mental illness and suicide. Like our over 200 statewide volunteers, I do this work because someone I love lives with a mental health condition. You may have heard of late that our policymakers are facing a challenging task in crafting the state's budget for the next biennium. Governor Ayotte has been steadfast in her support of mental health services, as evidenced in her budget and in her recent op-ed, where she stated that we cannot afford to move backward when it comes to mental health. Thank you, Governor. We could not agree more. We are also grateful that the New Hampshire Senate has rolled up their sleeves to help ensure stable funding for mental health care. The Senate budget includes a provision, SB 255, to provide a permanent funding source for the 988 crisis response system through a telecom surcharge, which ensure that Granite Staters experiencing a mental health crisis can continue to find help and hope 24 hours a day, 7 days a week. Last year alone, New Hampshire's 2 call centers responded to over 46,000 calls. The Senate has also included in their budget a provision, SB 128, that will help increase access to care for children and youth by requiring private insurance companies to help pay for care coordination services. Last year, the state of New Hampshire paid $1.9 million so that children with private insurance could access the Fast Forward wraparound program. As an employer, health insurance is one of our biggest expenses. Indeed, it is the second largest expense in our budget after our employees' salaries. It seems more than reasonable that insurance carriers help pay for these essential services for our children. These investments by the Senate will strengthen our mental health system and increase access to care without increasing costs in the state budget. As I mentioned, I do this work because someone I love lives with a mental illness. My son, who was first diagnosed with an emotional disorder at age 5 and a serious mental illness by the age of 14. He is now an adult, still in treatment, doing well, and inspires me every day. When he was young, trying to access the care he needed to stay at home, in his school, and grow and thrive was, frankly, like running a gauntlet. With fragmented services and discriminatory attitudes, even from providers and educators. It was incredibly isolating, and both of us often felt alone. Today, I am beyond proud that NAMI New Hampshire is a partner in the Fast Forward Wraparound program, providing family peer support to families like mine. Through Fast Forward, families have access to care coordination so that they do not have to run that gauntlet, and they know they are not alone. It's my pleasure now to turn things over to my colleague, Dennis Kalka.
Good morning. My name is Dennis Kalka, and I'm the Director for Connected Families, one of the two care management entities that administer wraparound programs in New Hampshire, the other being NFI North. An investment in children's mental health is one of the greatest investments we can make. It should also ensure that access and care are delivered appropriately to all who qualify. Wraparound is a nationally recognized, evidence-based care coordination approach that helps youth and families identify their strengths and needs and then builds on a plan that connects them to the right supports and services in their communities. For families experiencing a behavioral health crisis, Wraparound is not just helpful, it's life-changing. It works to keep families together in their community. The New Hampshire wraparound model is designed on these national models. This type of care coordination is critical and cannot wait. The best comparison I can make is that a child with a serious mental health challenge and concern is no different than a child with cancer. They need care coordination to manage all of what they're going to confront. The outcomes are similar when proper care is not provided, which makes the care critical. The state of New Hampshire has made significant investments in our children's system of care over the last 12 years. In partnership with the Bureau for Children's Behavioral Health, access to eligible families has not been limited, as we know the support is essential to any family who needs it. Right now, as a provider of wraparound services, we only make it through a portion of the year treating the privately insured children before general funds run out. After that, we still provide the care, but without compensation. We do this because these families and children matter, as do all New Hampshire children and families. They deserve to stay with the families. These children deserve to stay with their families in their homes, in their schools, and with the people and the supports that they know. SB 128 provides greater support to this vulnerable population and will ensure sound care is provided. New Hampshire lawmakers have consistently shown their commitment to preserving family integrity and supporting children's mental health. SB 128 honors that commitment. It creates a sustainable, reliable funding source that ensures that all families, regardless of their insurance coverage, can access the care they need. SB 128 is critical to New Hampshire families. We urge the legislature to support its inclusion in the budget, as this will help support all families. Thank you very much. And I would like to turn it over to Michelle Merritt now to provide comment.
Good morning, everyone, and thank you for being here. Again, my name is Michelle Merritt. I serve as the president at New Futures, a nonprofit, nonpartisan policy and advocacy organization, and we work to improve the health and well-being of all Granite Staters. One of our core issue areas is children's behavioral health, and I personally have worked on children's behavioral health policy for the better part of 12 years, and I am speaking here today coming from a place of immense frustration. Right now, more than 30% of young people in our state are living with a diagnosed emotional or behavioral health condition. We know this. When their needs escalate, families often have nowhere to turn. Children are left boarding in hospital emergency rooms for days, sometimes weeks, waiting for psychiatric care. That's not treatment, that's trauma, and it's unsustainable. And there is a better solution. You just heard it from Dennis. Fast Forward is a program that delivers coordinated, evidence-based care coordination for children that keeps them out of the hospital and in their homes. For years, New Hampshire's Medicaid program has reimbursed for Fast Forward because it works. It prevents costly hospitalizations and improves outcomes for kids. And yet, commercial carriers continue to refuse coverage for this service, even though 20% of children accessing Fast Forward are privately insured. The resulting cost shift is both inequitable and fiscally irresponsible. And let's be clear, Fast Forward provides not just clinical treatment, but also essential wraparound services, care coordination, peer support, family engagement. These are standard across other health conditions. Cancer patients receive care navigators. Adults in recovery get peer recovery coaches. But children with severe mental illness, nope. And here's the quiet part that I'm gonna say out loud. There is a reason for this. Health insurance companies have a perverse financial incentive to delay or deny access to these services because when they do, the burden and cost shifts to the state, to the taxpayer. The system rewards commercial and carriers for providing the least amount of care possible to kids with mental illness. Without timely access to middle-tier behavioral health supports like Fast Forward, children decompensate until the point that they require inpatient hospitalization. At that point, many children become eligible for Medicaid, and then the state assumes full financial responsibility for their care. In fact, as Susan had mentioned, the Department of Health and Human Services is already paying $1.9 million in general funds a year to provide Fast Forward services to those 20% of children with private insurance. And the financial cost to taxpayers is even greater when you factor in the children who are privately insured, hospitalized, who then qualify for Medicaid. This dynamic penalizes families with private insurance who must navigate a complex eligibility process or pay out of pocket, while commercial carriers avoid reimbursing for services that would have stabilized those children earlier and avoided costly hospitalization. These are not abstract policy failures. These are real families. One parent shared their experience with their daughter. She was boarded in a hospital emergency room multiple times before eventually spending weeks inpatient at a psychiatric hospital. They spent Christmas with their 12-year-old daughter in a sterile visitors area, far from home and family. That child needed care long before she reached a crisis, and her insurance company would not cover it. For 5 years, we have tried to resolve this issue outside of legislation. Work groups have been convened, billing codes reviewed, provider contracts discussed, and still absolutely no movement. And that's why SB 128 was filed. This legislation is not about expanding government. It's about market accountability and fairness. Families who have insurance should not be forced to fight their insurance carrier or go broke trying to find help for their child. And taxpayers should not be subsidizing private plans who refuse to cover proven care for their pediatric members. SB 128 ensures that every child in New Hampshire, regardless of their insurance, can access the support they need before they reach a crisis point. It protects families, it protects public funds, and it restores basic fairness to a system that is clearly not working. This is the definition of good and responsible governance. The need could not be more urgent, and the solution is simple. Support SB 128 and its inclusion in the state budget. And now I'm going to pass it off to Cheryl Gurin.
Thank you, Michelle. So good morning. My name is Cheryl Gurin. I live in Enfield, New Hampshire. I work in human resources at Dartmouth College, and I am a volunteer for NAMI New Hampshire on their board of directors. But today I'm here as a mom of a family that's been described by Michelle and by Dennis. My son lives with a serious mental health condition. As a young child, my son struggled with anxiety, and at the age of 10, he started running from his school, running from the after-school program, eventually struggled to go to school at all, then was unable to leave the house, unable to leave his room, and for a long time, unable to get out of his own bed. I spent 4 years navigating New Hampshire's system, gauntlet, as Susan described, seeking support and services. Our family experienced emergency room boarding, truancy, Hampstead stay, and trauma through that experience. Simply put, my family was in crisis. We eventually were able to access the Fast Forward program. And for those that don't know, FAST means families and systems working together. And my family received the wraparound services, the care coordination, and peer support that others have spoken about. Looking back, our participation in that Fast Forward program was one of the key turning points in my son's recovery and in our family's ability to move out of crisis. So even though I had employer-sponsored health coverage, access to the Fast Forward program was only possible once my son's condition worsened to the point of eligibility for state services and funded by taxpayer dollars. It should not have taken years of struggle before my family received the services that they needed, that I needed. Care coordination services and peer support are hard to understand what that means unless you've been through it. So I would describe it as finally having somebody in my corner, someone that could help me to navigate all of what I needed when I myself was struggling. And those services are necessary and life-saving. They should be available to all families, even those with private insurance. And ideally, before that family is in crisis and to the point where their children are eligible for state services. Now, thanks to the policies passed in the Senate budget, other families going through what I have been through will be able to access this care as they need it. It's been 4 years since we participated in the Fast Forward program, and I'm very proud of my son, who now has a 3.6 cumulative GPA and is only a few credits away from his high school diploma. The Fast Forward program helped make that possible and can do the same for so many other Granite State families. Thank you. Susan?
Thank you, Cheryl, for sharing your family story. And I want to thank my colleagues who are also up here and now open things up for any questions that anyone might have.
Are there any insurance companies that are providing coverage voluntarily right now for this kind of service?
Great question, Kevin. No, there are not at this time. The only way Fast Forward is paid for is either by the state or ultimately Medicaid.
And there are, as you know, there are business groups, taxpayer groups that oppose this bill, calling it a new tax on them. Would you respond to that?
Again, I go back to my experience as an employer. Health insurance is our second largest expense after our employees' salaries and wages. And it is beyond frustrating to think that what is such an enormous expense, and is, I would imagine, for most employers, that it does not offer what I would consider essential mental health services for our children. And instead, as Michelle described, it does appear that delaying those services ultimately is financially benefit to the carriers. So I would love to have a conversation with my colleagues in the business community about what are they getting for them? Are they getting their money's worth in terms of children's mental health services? I don't know if anyone else wants to respond.
Yeah, I'll just also quickly add on to that, the bill itself, SB 128, is a little bit complicated to understand from a policy perspective. So unless you understand this cost shifting dynamic, it is not plain to see when you're sort of reading it. But in actuality and in practice, right now, $4 million thereabouts of general funds are subsidizing the care of privately insured kids. That falls on the taxpayer. And then you add on to that the state's responsibility to cover the gap for those kids that have deteriorated with private insurance to the point of qualifying for Medicaid, and the expenses that then fall on the taxpayer on that front are even greater. So for me, the claim that this is something that will cause premiums to go up, is a dog whistle. We know that fast forward, because the experience within the Medicaid program has been that since fast forward was implemented, there's been a 25% reduction in hospitalization, or 25%, I can get the exact number, reduction in expenses related to children's mental health. This is a cost-saving measure, so if anything, it would be cost neutral for a health insurance plan. Because they also say that they cover some of the services, which, I mean, we know is not the case. So hopefully that helps to answer your question.
Yep, thank you.
Any other questions?
Is there,
You looked like you were going to say.
yeah, is there like, have y'all been able to identify the research that shows maybe the long-term cost savings of non-hospitalization? You know, is that something that is quantifiable?
So I know Dennis can talk to that, but the Department of Health and Human Services recently released a system of care for children's behavioral health assessment. And in that assessment has the cost savings over time, which is 25%. So that is documented somewhere, and I know that you have your own.
And when you think of, the best way like I mentioned in my comments, when you think of care for the highest need, we're not talking about, kids who need therapy once a week. In the general public, I think the nice piece is from a mental health perspective, the general public now understands there is therapy and there is this thing called a psychiatric hospital. So we sort of understand those concepts, but we don't understand what is possible and what should be possible in between there. But when you think of someone, a child, if you have a child who has this significant, take the example that was provided, the level of care and the level of coordination that has to happen is immense. And you can have families having 47, 50 meetings scheduled, in a month. And it's like, well, okay, you got to do that with your job too. So if you have someone who helps you coordinate that care,
Right.
and then builds that team around them, but it really is about care coordination. But if you do truly look at, okay, a person with a mental health illness and a person with cancer, the life outcomes are the same. Their life expectancy is 25 years less. There's lots of studies that talk about the differences of you treat it, you don't treat it, what's going to happen. But it is, and I appreciate your question because most people are trying to find that. They want to know a dollar figure. They have to nail it down to a dollar figure. It's like, well, I can nail it down to families and the experience that they've had. And I would say, most people don't understand this, but I would say that as a society, we're all impacted by mental health. The statistics that were shared in terms of numbers of people who are diagnosed within our country or our state, it's a significant number. And I would say it's touching everyone. It's touched my family. My wife has suffered from depression. And I know if we didn't have the resources or didn't have the ability to coordinate that care and manage it, now I work in it. So I have a different level of understanding. But someone who this comes up, this is massive. And it's really hard.
I would add to that, there is a cost that is unbearable. And that is, I hear from families often who are in this crisis and have perhaps often a child now boarding in an emergency department. And they describe physical restraints, children getting injured by just in putting those restraints on, days and sometimes weeks. And often these are children who are in their teens and agreed to this treatment, recognizing their own mental health challenges at that time, often suicidal ideation. I fear, one, these children are traumatized by the very system they are seeking help from. And then I think, will they ever seek help again? And the long-term costs are unbearable if we don't take care of our children as quickly and intervene early.
And I'm biased, I work in it, but I tell you, if we invest in children's mental health, the investment, it's the same thing. You invest in early childhood education. You do the investment now. Get the children, get families in the position to move into those next phases of life. It's critical. her child is now is far more prepared by going through this process than if they didn't have it. And
He wouldn't be alive. He wouldn't be alive.
You can move forward, you don't have to stand in the background. We have any other questions?
I would just say I appreciate your interest.
Yes.
Yeah, thank you for coming.
Yes, I truly thank you all for being here today. I once again want to say how incredibly grateful we are to Governor Ayotte and the New Hampshire Senate for supporting access to essential mental health care. We absolutely cannot afford to go backwards, and our children need us to continue the work onward. I also want to make sure to remind folks that if you or someone you know is experiencing a mental health crisis, help is available 24/7 by calling or texting 988. You are not alone. Thank you all so much.